Good morning or good afternoon to everyone. My name is Jean-Françoise Nizigimana. I'm the program manager, the co-founder of the Refugee Women's Health Clinic. Today, I would like to share with you about an innovative healthcare model of literacy that has helped remove cultural barriers to care. We will be talking about the Refugee Women's Health Clinic at ValueWise Health. What is the Refugee Women's Health Clinic? The Refugee Women's Health Clinic has a mission to provide culturally grounded and linguistically appropriate health services to the refugee women and immigrant women that are in the Phoenix metropolitan area. The overarching goal is to reduce and eventually eliminate health disparities and cultural barriers to care. During this presentation, we will be able to go over certain objectives. We hope to learn that framework of care that help refugee women access health care. We hope to also show how health literacy techniques such as CBPR improve health outcomes. We want to give you examples of informed, culturally tailored healthcare services to improve refugee maternal and child health outcomes. We will go over suggested best practices as well. At the Refugee Women's Health Clinic, we have designed a cultural health navigation model that is based on 5 core competencies. We are there for competent care and service delivery. We're there for improved culture of safety. We're there to enhance culturally informed health education. We are there to make sure we are increasing coordination of care and quality health outcomes. The Refugee Women's Health Clinic Cultural Health Navigation model is a logic model. And this is being reflected in this slide. The logic model that we have here outlined shows the value of employing cultural health navigators. Indeed, what do they bring with them? They share the culture of the patient they serve. They have shared lived experience. They share the language and norms. They also have the knowledge of the US healthcare system. They are also trained medical interpreters. So what do they do every day? They have intense coordination of care. They support the patient in assuring that they know how to navigate the US healthcare system. They interpret and translate for them. They ensure medication education and adherence. And they conduct health literacy sessions as needed. So what we get as output, of course, there is an increased engagement of refugee patients with providers. We're able to monitor the refugee patient throughout the continuum of care. There is an increased trust of refugee patients in the system as they come and see who they know and they feel comfortable with talking to. And increased health literacy because education has been lacking from where the patients are coming from, and health literacy is almost known. So our cultural health navigators are able to convey messages in cultural context that is acceptable by the patient. What are our outcomes? The patients are able to increase utilization of various health services. They are able to improve self-efficacy, and we are able to see clinical outcomes that are satisfactory through continuum of care. And of course, there is an improved clinical outcomes for moms, neonates, children, and men. As a matter of fact, this model is very cost efficient. We are able to see reduced C-section rates, reduced no-show rates, reduced inpatient and emergency admissions. For those who don't know the Refugee Women's Health Clinic yet, I would like to go through some quick facts. The Refugee Women's Health Clinic has been launched since 2008. So far, we've been able to serve 9,000 women from 64 countries speaking 62 languages through over 1,300 patient visits. We've been therefore able to deliver over 900 babies so far, and we also have been able to help refugee women screen for mental health services. Over 850 now have been screened for mental health services. Other facts are relevant to some demographics. Majority of patients we serve are from Sub-Saharan Africa, Southeast Asia, the Middle East, and some European countries. Of all the patients we serve, 79% are from these four regions: African Great Lakes regions, which cover Congo, Burundi, Rwanda, Kenya, and Tanzania; Arabic-speaking nations, we're talking about Iraq, Syria, Egypt, Sudan. The other countries that are very well represented at the Refugee Women's Health Clinic are Somalia and Burma. In terms of languages, they are reflective of these countries we just covered. From the African Great Lakes region, we primarily have Swahili and Kinyarwanda being the most spoken by the patient we serve, followed by Arabic language, then Somali and Burmese. And the charts are also giving you an idea of more countries that and languages that are being served, other than those I mentioned. When taking care of our patient at the Refugee Women's Health Clinic, we are also aware of some socio-economic factors that influence the health-seeking behaviors. We are aware that some of the factors, such as lack of education, lack of social support, lack of access to care, to services and resources, the disconnect between providers and the refugee and immigrant communities, the issue of public safety, the mental health, and fourth, all those are some of the factors that hinder the proper health-seeking attitude. For the social determinant of health, we've been able to address education. Over 200 Somali women received breast health education. We are also able to provide ongoing expectant mothers classes to those who are in their last trimester and are new moms in the United States, so they can learn about prenatal care and postnatal education. Over 800 women so far benefited of that class. In terms of access to care, we have done a health literacy demonstration that trained Burmese and Bhutanese as cultural health advisors, and over 318 community fellows have been able to receive healthcare services and be enrolled in healthcare plans. The Refugee Women's Health Clinic has been a medical home to nearly now 19,000 single patients. I'm sorry for the typo there. And over 2,000 babies here have been delivered. Social support is key. We've been able to put together a traditional or celebrating the holiday season together, and every year 350 to 400 women received gifts annually at ValueWise Health. We are also aware of the modalities of learning that are not always accessible to refugee women and immigrants with low literacy level. So the audiovisual modalities through health videos have been created to convey culturally appropriate health messages to fellow refugees. We are also aware of the child safety, injury preventions. With that said, we've been able to put together a car seat class safety measures and offer car seats to women who are new in the United States because they have not had the experience of using a car seat back home, whereas here it's a required tool for safety and for the protection of the baby born and the babies in general. We have been able to use the refugee health screener to help refugees be evaluated so they can receive further behavioral health services as needed. As we know, most of the refugees have suffered PTSD, anxiety, and depression due to war trauma and other atrocities they have experienced. 37 English and Swahili speaking women completed physical and emotional health exercise. How have we addressed culturally informed health literacy project? A number of few projects have been in place. We have examples of informed health videos in Somali and Swahili to improve literacy among Somali and Congolese refugees. We have also launched a project called Aku Anyi Swasta, Help for Health. Help for health. Aku means help, Anyi means for, health means, Swasta means health. This is in the Burmese and Bhutanese language respectively. This project helped community health advisors to reach out to their own community fellow and help them access care. Culturally enhanced health care services for women affected by female genital cutting in Arizona is another huge project that we put together to help those who have undergone the practice of female genital cutting. And finally, we have recently launched a ValueWise Health culturally informed COVID-19 health preventative videos. Let's review the first health literacy project, the Aku Anyi Swasta, which is an initiative for healthy Burmese and Bhutanese communities. This initiative is a community-based participatory project that had the goal to promote healthy Burmese and Bhutanese refugee communities. It was a community-based participatory project because the communities were engaged themselves from the design, the development, and the implementation of the project, as well as the dissemination of findings. They picked the name of this project, Aku Anyi Swasta, themselves. They also picked their own logo, which was reflected in the previous slide. That was very, very interesting because we didn't go for what we wanted. Rather, we wanted them to tell us how they wanted to define the project. So what is the overview now of this project? A community health advisors program has been developed to bridge the gap in health literacy in vulnerable communities by enhancing the dissemination of health information in order to improve access to healthcare services and the adoption of preventative health behavior by specifically targeting newly arrived Asian refugee population in Arizona. The overall goal was to understand and address Burmese and Bhutanese health disparities. How did we go by this? First, we established key community partnerships between the Burmese and Bhutanese refugee communities and the Refugee Women's Health Clinic and its coalition. We also surveyed the community to assess unique needs that are relevant to them and their communities. We trained and certified community leaders to become community health advisors using the train-the-trainer model. Then we finally implemented the educational initiatives to increase health literacy and overall health among these populations. What did the community health advisors do? They went through training to become licensed, certified applicant counselors in the state of Arizona. 11 of them got certified. They did also do trainings on chronic disease self-management. Then they were able to conduct community outreach initiatives, and they were able to deliver health information sessions on the topics that were discussed. They finally also enrolled community members through their own enrollment event during the Affordable Care Act, and they helped their own fellows to receive healthcare insurance. And you can see them on the pictures. We were very proud of the outcome of the Aku Ani Shwasta Health Literacy Project. The project helped us increase access to healthcare. It helped us help the communities increase access to healthcare. Indeed, 307 Burmese and Bhutanese were successfully enrolled in healthcare plans. They also received relevant health information through educational meetings that were held in their own communities and receiving translated materials in multiple languages. Most importantly, the 11 cultural health advisors are licensed for 4 years in the state of Arizona as certified applicant counselors. And with that, they did gain transferable skills and work experience. These slides give us the evaluation and the performance measures that we were looking for. How did we evaluate ourselves during that project? We looked at the usefulness and the appropriateness of the cultural health advisors. And we also looked at the health topics of interest of the communities. Looking at the usefulness of cultural health advisors, 91% reported having received the right amount of information. 92% felt like the cultural health navigator was appropriate to guide them through the enrollment process. And 94% also shared that they would like to continue receiving more information from their cultural health advisors. As far as health topics is concerned, 3 topics of interest were revealed: diabetes, heart disease, and cancer were the top 3 they would like to receive information in. Another example is related to how we have empowered Congolese men and women, especially Congolese women, to heal. Congolese women have suffered gender-based violence, and some of them have been struggled to regain their self-esteem. And some of them still wanting to seek acceptance from their partners. Therefore, Congolese health experts, Congolese ambassadors who were representing their different groups in the communities, in the community of the Congolese, came together and created video series on getting and staying well in general. During those health videos, men were talking about the issues of gender-based violence that inflicted their wives, their women, and how they can help them heal and move forward toward the path of recovery. Whereas women were speaking about finding wellness after war and see how they will seek or if they can gain support and find support in each other. The link to these videos is listed below for those who would like to view in detail. Another example of health literacy project that we put together was one to inform Somali women on women's reproductive and preventative health. Those videos are 4 segments. They are in 4 segments, and you can see the links on the right side of this slide. They are in-depth in terms of the introduction to U.S. healthcare system. They are talking about the body of Somali before, during, and after pregnancy. These videos are important because Somali women, majority of them have undergone what we call female genital cutting. This practice has implications to their reproductive life, and they also have bad maternal and neonatal outcomes because of the types, depending on the types of cutting one has gone through. The links reveal what they need to know in terms of prenatal care, in terms of resources for female genital cutting, and in terms of their gynecological health in general. We also have launched a statewide initiative in Arizona to enhance culturally informed healthcare services specific for women affected by female genital cutting in Arizona. As a matter of fact, the World Health Organization showed that over 200 million women and girls globally and over 500,000 in the United States have been affected. There are long-term health problems linked to the practice, including pain, infection, childbirth complications, psychological injuries, and even death in some occasions. There are, however, now barriers to high quality healthcare in the host country of those Somali women and everyone affected by female genital cutting due to lack of insurance, for instance, discrimination, low health literacy, cultural and linguistic barriers, as well as provider inexperience. The women you see on these slides are women who were certified as community mobilizers and community educators and ambassadors to be able to share resources and services for all those that needed help due to the practice of female genital cutting. They were part of the design of the project, the development of the project, the implementation of the project, and the dissemination effort of the result of this project. We couldn't do anything without them. As a matter of fact, we were able to get to the following result in the next slide. With the community mobilizers, we were able to reach out to over 800 young women, primarily Muslim, who are largely on public benefits. They have Medicaid. They seem to be newcomers. They have been here for an average of 8 years. With limited education, as you can see, 64% of them have less than high school diploma, and 80% of them live before the federal poverty guidelines. They live below the federal poverty level. Those are your key demographics. In terms of findings, 80% of the surveyed women had female genital cutting. 21% of those women had complications at the time of cutting. Some of these complications ranged from extreme pain and difficulty urinating, excessive bleeding, shock, long recovery, infections, and some difficulty walking. Just a few for you to know, a few complications that we can share with them. But you can see that definitely the practice has serious complications to their well-being. Another project had to do with promoting preconception health literacy among the refugee women. Many women have no concept of family planning, or they have their own cultural beliefs around the concept. We wanted to see if they have an idea of what the reproductive plan was about, and to see if they could define that reproductive plan for themselves. So what did we do? The cultural health navigators created an animated avatar video with voiceovers in Arabic, Burmese, Kirundi, Somali, and English. The videos are targeted to educate women and about replay, reproductive plan for you, replay, and birth spacing, and then assess readiness for behavior change after they have seen and learned the content of the videos. The voiceover were recorded by community members and cultural health navigators. The script was on developing a reproductive life plan and birth spacing. And the plan was to make sure the videos are disseminated through focus groups. The results were amazing and satisfactory. They showed there is a multilingual audiovisual modality now available to convey preconception health education to newly arrived refugees with limited health literacy. The results showed also there is a greater comprehension of what it meant to have a reproductive plan. There was also a consensus on being able to freely discuss having a replay with their partner. They also showed there was an increased agreement that having a baby too early after previous birth affects the next pregnancy. They also show there is a benefit of waiting 2 years before having a subsequent child. The result also told us the videos were an acceptable modality to convey health information in their native language. Other health literacy efforts cover a series of COVID-19 health videos done in 12 languages that you can see on the right side of the screen. The videos included footage of cultural health navigators in an effort to present the material in a culturally familiar manner. They did learn up-to-date knowledge of the virus. The videos cover the following content: up-to-date knowledge of the virus, signs and symptoms of the virus, risk factors associated with the virus, as well as preventative health and precautions. The cultural health navigators themselves were part of the creation of the videos. They were acting in the videos under the supervision of our refugee pediatrician, Dr. Michael Doe. They did a great job, and we have the link below for your further learning information. There are some tools that we are using at the Refugee Women's Health Clinic to empower women to speak up and take care of themselves. We have developed an access to care card and an appointment card, where when they have a taxi coming to pick them up, or when they have the paramedics coming to pick them up, they hand the card to them, which says, "I'm a refugee receiving care at Valleywise Health Medical Center. Please take me there." That card has information about the cultural health navigator, the phone number, if possible, and the addresses where to go, where they see their doctors, as well as the providers who see them. Very, very important. This card has been successful once used because it has helped us, the Refugee Women's Health Clinic, retain our patient. And the patients have been happy when they are able to have continuum of care with their own providers. The appointment card is to help them to make their own appointment with easy steps, where they can simply say their name, how they need to talk to someone, how they need to make an appointment. We tell them to volunteer to share their insurance plan when they are calling the right provider. They show their address, and they ask when they can come and whether or not they can get transportation. Those two cards have been very helpful. Those cards have empowered women for self-efficacy. I'm pleased at this moment to share our clinical outcomes which we couldn't have without the team of competent cultural health navigators. Since the launch of the clinic, we've been able to have a growth of patients yearly. Even despite this precarious moment of immigration, despite our precarious moment we are in the political arena, but due to increased trust, due to the fact that they feel the clinic is their home, medical home, they've been able to continue coming and receiving care at the Refugee Women's Health Clinic at Valleywise Health. We've been able to deliver all these babies, now close to 2,000 babies so far, which led to the creation of Refugee Pediatric Medical Home. The Refugee Pediatric Medical Home is indeed, I would say, an extension of the growth of the Refugee Women's Health Clinic. Other good clinical outcomes we are proud to share are from what we have been able to nurture with the Mercy Care Health Plan through Mercy Care value-based solutions. Mercy Care partnered with us to support two cultural health navigators to help decrease undesirable maternal and neonatal outcomes. This project started in 2017, when you look at the baseline period, and the project is still going on. But when we did the first performance period to check where we're at, it was June 2019. We indeed were able to show improved performance quality measures. By then, we had increased timeliness of prenatal visit and postpartum visit. We had reduced inpatient admissions between prenatal visit and postpartum. We had also been able to decrease live birth that come with less than 25 grams. We were indeed able to increase healthier babies who are born with a weight greater than 2,500. This partnership wouldn't be possible without Maria Puerta, who at that time, while still working with Mercy Care, advocated strongly for the Refugee Women's Health Clinic and for the support we needed to show that culturally competent quality health services provided by cultural health navigators can prove great outcomes. She was a great advocate for the Mercy Care-based solution grant, and we are thankful for her and Mercy Care overall, of course, and their leadership. Value-based solution through Mercy Care showed quality outcomes that are very satisfactory. As you can see, the slides speaks for itself, the numbers speak for themselves. You can see I just mentioned it. And when we have good quality outcomes, it is all transferable in money savings. We have saved the system tons of monies. We have saved the healthcare plan tons of money, and we have saved the Medicaid program tons of monies. So cultural health navigators are doing great. We've been able to reduce inpatient admissions. The babies were born healthy with great weight, and moms were coming to prenatal care early. They initiated prenatal care early, and they continued their visit throughout their pregnancy. So it's amazing, it's good. I'm very happy when I speak to this slide. This slide is one that gives evidence to the importance of using cultural health navigators. There was a study that was done with Dr. Bankett Thomas in 2017 with the team of the Refugee Women's Health Clinic, including Dr. Johnson Agbaku, who is the founding director and medical director of the Refugee Women's Health Clinic. Together, we were looking at experiences of refugee women in accessing and utilizing the Refugee Women's Health Clinic. What did the research show? Research showed that having trained medical interpreters who work as cultural health navigators at the Refugee Women's Health Clinic is a key driver of utilizing the clinical in general. The women shared that because of cultural health navigators are women like themselves and belong to the same culture, same nationality and language, they are more open to communicate with them regarding their feelings, their health, and their other needs, which makes it easier for them to use prenatal care. Finally, refugee women also want to see cultural health navigators who are of the appropriate age, language, and gender. These are a few findings among other great experiences that are in this published article. I would like to end my presentations by making sure that we all look at best practices that can help us improve quality health outcomes in our different healthcare systems. Please consider matching a language and a culture whenever possible. I'm talking about language and the culture. People might speak the same language as you, but they might be having a different culture or a set of beliefs than you. Look at that specific culture. Are they part of a homeless group? Are they part of LGBTQ group? Then accommodate them. Promote a joint plan for informed decision. And promote community voice. Include them, get their buy-in, engage them, and seek their participation. Why? Because if not understood and adequately integrated into clinical practice, the risk of misunderstanding and alienating patient is likely. So, what is the framework around promoting community engagement? You can look at it in this diagram. You can look at it. Community engagement is key to building strong relationships. Once you involve the community, once you assess their needs, once you assess their strengths, you can then learn what it takes to conduct an informed research that will shape programs that generate new knowledge. We don't want to do what they already know or what they already have. We need to do what they think and they are aware they need. And we need to involve them, especially key stakeholders and cultural health navigators or community health workers, to create health educational materials that are of need to them. We should shape programs that make sense to them, that respond to their needs. With my presentation ending, I want to share with you and tell you that it takes a community to get to the quality health care we want to see. Please let's constantly evaluate how far we are, with who is part of our services, who shapes those services, and who decides the direction the services go, who decides who needs to also receive and access those services. it takes a community to get to quality and culturally informed care, like it takes a village to raise a child. In order to have successful programs that are informative, that are addressing culturally informed services, we need a team. We need the resources that are coming from every single voice of everyone, every entity listed on my slide. With this said, I'm ending my presentation, and I want to thank sincerely the Cultural Health Navigators and the Refugee Healthcare team of ValueWise Health. And I want to thank our internal and external supporters who make this happen, who make this work happen. We thank you all for participating. We thank you all for listening. Now it will be time for questions.